am very pleased to have as my guest today my colleague and friend, Mike Sacopulos. He is the CEO of the Medical Risk Institute, which is a practice that assists in healthcare community with identifying problems and risks and mitigating different things for people. And that's kind of some of the things I'm going to have Mike talk about. He also, and I didn't know this, was the 2016 Lawyer of the Year, which must have been very cool, Mike. And he's written for Wall Street Journal, Forbes. He's done a whole lot of things. And he also is a publisher for the Sound Practice podcast. I'll put some information up on the bottom while Mike's speaking, so that if you want to check it out, you can go and take a listen. It is very interesting. I checked some of it out prior to our broadcast, and that was something we were talking about before we finally figured out how to get us live today. And so, oh, thanks, lady. She said, "Don't be sorry. These things happen sometimes with technology." That's
She's
very nice of
absolutely right.
you.
They do happen. They do happen. So no worries.
So, welcome, Mike. I'm
Well,
glad you
thank
could
you
take
so
some
much
time
for
out
having me.
today.
Thank you
Yes.
so much for having me. I'm excited to be here.
Good. So, first of all, why don't you just give people some background on yourself, your company, just a little bits of how you got where you got, things like that.
Sure. So by way of background, I'm an attorney. I practice in Indiana, but most of my clients are around the country. I have been working at a law firm or practicing as an attorney for more than 25 years. That makes me feel very old when I say such things. And I started out working for my father, who's an attorney, and he did all medical malpractice defense work. And so when I started, I came on and was helping him defend doctors, and I quickly learned that our clients didn't want to be in the courtroom, and I didn't really want to either, and that I should spend my time trying to keep people out of trouble rather than defending them once they were already in it. And so that kind of launched my career. I began working with a physician, Jeff Siegel, who started a company called Medical Justice. And today, Medical Justice has thousands of members in all 50 states, and I'm their general counsel. And
Oh,
I help. My job there is to identify risks and keep people from being sued. I also do work, Betty, as you mentioned, through the Medical Risk Institute, which is compliance based, and so I'm helping groups from solo practitioners on up to larger size organizations keep compliant, and that often means in the HIPAA arena with patient privacy. But more recently, I've been spending a lot of time on coding and billing compliance areas and helping people that are facing audits or having internal trouble as to what they need to do to be compliant and not have to worry about a knock at the door.
and it made me think when you brought up compliance, something I was at a conference a few weeks ago for medical auditing specialists. And one of the things that came up, they were talking, of course, a lot about compliance. And it just made me think while you were saying that. And I made the comment there that I still don't see a lot of small offices and small practices that have compliance plans. Um, it just, it brought it to me when you were saying that, because every time I do an audit, that's the first thing I ask for is their compliance plan and any E&M policies or anything like that that they have. And I'm still seeing a whole lot of them that don't have any. They'll like a compliance plan, that kind of response. Are you still seeing that
I,
a
I
lot?
am, I am, and you're right. It's usually the smaller the practice, and they can be overwhelmed by just all the requirements. So I try to put together a basket of what all a small practice needs. Look, there's less of a trick to compliance when you're HCA or you have floors of a office building of attorneys, right? The
Yeah.
trick on this is to be able to help someone who's a smaller practice become compliant, because most of those rules and regulations apply just the same to a solo practitioner as they do to a large scale health system. And so, how do we balance that? And that's one area that I spend lots of my time on. And frankly, it's much harder because people have limited resources, and so we have to know exactly what we have to do and comply, but not be excessive, and certainly balance some risks. And sometimes people will just tell me, "Look, there's only so much I can do. I got to keep the doors open and see patients. I've got a little bit of time for you, compliance boy, but that's about it." And I, I salute sharply because I totally understand that. We could spend all our days worried about compliance and never see a single patient, and that's just ridiculous. So, how do we balance this? How do we have a practical approach to all of this? And that's what you get when you work with small size practices. It's just out of necessity that happens.
Yeah, so a small practice doesn't need a 20 page or a 40
No.
page plan. They just need to make sure they're hitting all the important spots, and that's kind of where, you can come in and just say, okay, here are the key areas that we need to make sure, that you're covered everywhere that's important, or that a payor like Medicare or somebody would want to see, right? If they came knocking at your door.
You're exactly right, Betty, because you're not the first. You're not the only person who first asked for a compliance plan, and I will tell you that the government will do that as well. The first thing is to see, and on the other side with HIPAA, the first thing that's asked for is a risk assessment. So these are kind of your crucial documents to have because they're going to be asked for first thing, and they're going to be expected to be emailed off. It's not like somebody has to physically come to you. They can do this by an email, and you best be prepared.
Okay. So first thing on our list is to make sure for all the small practices out there that you really do take a look and make sure that you're looking at that for compliance plans and things like that, that you need something and that then everybody needs to know about it too, right? That was the other big thing, that it can't be something that, sits on a shelf somewhere. Nobody's ever heard of it. If somebody walks in and they're like, oh, we have a compliance plan, that's pretty bad.
I've had that where I was in a practice once, and I asked. They said, "I think we have one. It's probably down in the stack. It's been a while." And I thought, okay, that's pretty telling. So it happens. I understand, but you're right. You don't get any partial credit for this if you don't know that you have it or that your staff has never looked at it or heard of it.
Okay. All right. Now, just switching gears a little bit I mentioned the podcast thing. So, what kind of things in the podcast do you cover? And, how long have you been doing it? And I'll put a link again, I'll
Sure.
put a message up for people on the podcast to see it.
Absolutely. So the title of the podcast is Sound Practice. It is owned by the American Association for Physician Leadership. It's their podcast, and they hire me as the host. And so, because of that, and that organization is large scale. American Association for Physician Leadership is based out of Florida. It used to be the American College of Physician Executives was the old name, and they changed
Oh,
their
yeah.
name. And so they have a large professional staff that comes up with great ideas for guests. And so, although it focuses on leadership, we hit a lot of other ideas too. And so we've had great guests in this past year. Certainly, we've had Dr. Fauci was on, and we've had Anna McKee. Dr. McKee is the chief medical officer for the Joint Commission, which was
Oh,
a
really?
very interesting guest. And we've also had the president, Dr. Chaudhry, the president of the Federation of State Medical Boards. These are the people in charge of your medical licenses. So we've had some interesting guests and try to keep current with issues that would be interesting to practice managers as well as practicing physicians. It's very much a podcast for the medical industry and not for the lay public, if that makes sense.
Yes. And so, just because I'm just getting in, I know I'm a dinosaur, but I'm just getting into the whole podcast thing. And so, is it like where you can do it on Apple or
Sure.
Google or Spotify or blah blah blah, like a bajillion different
I,
places?
well, I am told I'm not the tech guru either, Betty. So I'm told that it's easy to find on things like Apple or Google Play or Stitcher or some of these other platforms. that are way more hip than I am. That it's easy to find, and the podcast has been going now for just at 3 years. We're coming up on our 100th episode, which everyone's excited about, and we release new episodes every other Wednesday. So every 2 weeks there's a new episode, and I try very diligently to keep these episodes at roughly 30 minutes, because there are lots of
Okay.
podcasts I like, but when they're 2 or 3 hours, it's just daunting. I don't have that much time each week to listen to someone. So I think part of my job is to condense things and give people an interesting 30 minutes as they're on their way to work, or for those that are much better a person than I am, that actually get out and exercise and they're listening to it while they run, that they can get it done, a relatively interesting topic in a short amount of time is what I'm shooting for.
Great, good. So, but the link that I put up on the screen there, if they just go there to,
That that
just on
should
their
that should do
computer,
it.
that works too. Okay, cool.
Absolutely,
All right.
you'd be able to find us easily.
All right. So you're into all kind of things, right?
Uh,
Looks.
that's right. I do. I get to do a lot of interesting things and meet a lot of interesting people, and I like to think that it makes me more effective as a lawyer because of hearing from different areas, and trying to do more of a 30,000 foot view. As you know, healthcare law, the if you were to look at the regulations for healthcare and the regulations of the US tax code, healthcare is about 8 times more volume than the entire tax code for the United States. So you think about, how much your accountant needs to know. This is an enormous body of information, and no one can know it all. So the idea is to have at least an overview to know where problems could come from, what's likely to be a problem, what's not, where to spend our effort. And so much of what I do is less about specific practice of law and more about the art of knowing where trouble can come from to keep people out of it.
Yeah. And I just want to tell you, a lady said she is going to check out your podcast, Mike.
Oh,
So she
very
made a
nice.
comment in there.
We're converting people one at a time. This is great. Very exciting.
All right. So, with some of the other things you do, you work, because I know you and I have, done some things together sometimes. So, how do you work with coders, auditors, consultants? How does that come into kind of play with what you're doing?
So what oftentimes happens, Betty, is that I'll get a call from a coder or a consultant saying, I have a practice in, you name it, wherever, the Northeast, and they're having a problem. And so step one is to make sure that the work gets covered under an attorney-client privilege, because the last thing you want to do as a consultant is find problems and propose solutions only to have the other side take it all away from you and use it as a spear against your person. And so we can cloak things in attorney-client privilege very easily without any real expense, and that prevents that problem. And so sometimes my role is just to give a little bit of general advice and provide a privilege for communications. Other times it's far more active, where I'm trying to negotiate settlements or deals on behalf of my client with the assistance of an expert uh, coder or biller like yourself, because frankly I don't know the rules and regulations as it relates to coding. That's beyond me, so I have to work with an expert like yourself to understand that component, and then I work on the legal end in combination with an absolute expert like yourself to do the best thing for the client and let them know, here are where the problems are, here's how we fix it, and here's how we deal with this audit or this demand for a refund. It's kind of a two-step approach, but you make my life much easier, quite honestly, because you've got the heavy lifting on this. That's for sure.
Well, I guess so. That sometimes can make you can be the heavy for us, though, sometimes, right?
Oh yeah, because everyone already assumes that the lawyer is going to be nasty and unresponsive, irritable, irascible. Yes, that I come with that already over my head. So it's easy for me to be the bad cop in a lot of situations too. So definitely we can do that.
So attorney-client privilege is something you brought up a good point for people that might be listening that aren't exactly sure, like, what does that mean when you go to do it? Could you
Right,
explain like how that works if me as a consultant were come to you and say, hey, I have a client, let's say that I once an audit done, there are 400 records, and they said already that they think that they're not so hot, so we're a little concerned about what we might find because they want it retrospective. So we're looking at claims that were already paid.
right.
What can like attorney-client privilege? How could that help the situation?
So if you were to not involve me or an attorney and just did the report, you go through those 400 records and they were right, they didn't do such a hot job, and you identify, let's say, a half a dozen, 8, 10 different areas that were problematic, that they were overpaid or that they did something inappropriately, and you do a great report for them saying, here's where your problems are, here's how to fix it, and you give them that report. The problem is in the future, the other side, the payers, can, if there's any kind of legal proceeding, get a copy of that report, which you've then just done the whole analysis for them as to where the problems are with this client. And that's the last thing we want. We're trying to get this report to help somebody. We certainly don't want to generate one that will become a spear and stick them. So if it comes under attorney client privilege, then in a legal proceeding, if it's asked for, we can say, no, it's legally protected. You are not allowed to see that. And the court will prohibit anybody from seeing it. And even before a legal proceeding, these companies understand that if an attorney's been involved, there's something called the work product privilege, and it comes under that, and any of this research would not be available. So the trick is to have an attorney who then hires the consultant because it's being done on behalf of the attorney. Now, we all know that the information is going to get to the client, but if it's communication with the attorney, that is protected. Where if it's just a communication with a consultant, it would not be protected. And so by looping it through, making it kind of one step removed, then you're completely protected in the event that it turns up something far worse than what your client may initially think, and all of a sudden you realize, oh boy, we've been overpaid, or we can't justify these reimbursements for significant amounts of money. You don't want that to be used against you when you're trying to do the right thing.
Yeah, that's not the kind of surprise you want. Yeah, at the end of an
No,
audit.
no, no. This is the time of the year for surprises, but that's not the one we want.
Yeah, so it's not like the new car on the with the big bow wrapped around. Yeah, it's not like that.
That's right. It's not Price is Right. Whoever got the closest to the actual price. No, no, we don't want any of those kind of spin the wheel and see what happens. No, I'm a little bit too buttoned up for that. We're not going to take those chances for anybody.
All right. And then, are you seeing currently like any specific trends in regards to like practices and stuff, or specialties that are kind of getting more attention than others? In what you're kind of going through lately.
I I am. I have seen a number of inquiries of all things into dermatology and ophthalmology lately, and I don't know, Betty, you've got your finger on the pulse of this, if that's what you're seeing as well. But those, I've had a number of those come across my desk recently, and then I saw something that it's less than 60 days old, and so we don't have this yet, but it's very, very frightening because the government can use something called the False Claims Act. And that says that the government has been billed inappropriately for services rendered to people. And so I'm thinking now about Medicare. When you submit a bill for services to someone who's on Medicare, that if you just made it up and the person never got the services, that would be a false claim, and there could be criminal penalties, and there certainly could be civil or monetary penalties. Well, I think we'd all agree if you're just making things up in the back room treating patients, you're going to have trouble, and you deserve to have trouble. But there's
Yep.
a recent ruling out of the Department of Justice that really kind of frightened me. And what they said was, if you are not in compliance with certain federal laws, then we think that all of your claims are false claims because we have paid you to have this infrastructure. So if you don't have the proper cyber infrastructure, even if you haven't been breached, every one of your claims is a false claim because we've paid for that infrastructure in each claim. That overhead's built in. And if you're not doing it, false claims, we can charge you triple what we paid you, plus attorney fees, put you under some kind of compliance for compliance
Corporate
going forward,
integrity.
corporate integrity agreement. That's right. And in odd situations, I don't think it would apply so much here. There are criminal penalties, but it doesn't really matter if you could think about your reimbursements having to pay back 3 times that plus attorney fees, and then have one of these corporate integrity agreements for years because you didn't have the right infrastructure. We should all be quaking under our beds that somebody doesn't try to enforce this. Very frightening.
How did, do you know, I mean, how did it come about, or what?
I think that this is a reaction to lots of ransomware attacks, and in my opinion, and I'm only speaking for myself, that this is the government going at the wrong people, right? I fully agree that ransomware has caused all kinds of problems for the medical industry, and there have been privacy breaches and all of that. But it seems to me that where we want to focus our effort is on the cyber criminals and not on the practitioners that are trying their best. And this kind of
Yeah.
approach is a big stick without any carrot. But you know what, Betty? No one picked up the phone and called me and said, "Hey, Mike, we're thinking about this. What are your opinions?" I'm
Do you
not the
give it
first
a
call
thumbs
on
up?
this. I'm in the background trying to, the catcher in the rye, trying to keep everybody in the rye field and not going over the cliff here. So I simply report, and you can imagine the messenger oftentimes gets walloped for this. But I am just telling you that this is something that I think we're going to see more of in unfortunately in 2022. They've also released rulings saying that if the quality of the care is not of a standard nature, that also is a false claim because we
Wow.
are expecting you to have at least a baseline quality, which seems to me that they're headed towards a statistical analysis. If your patients X% of people needed some kind of a redo or come back more frequently than the average, that maybe you're not providing the appropriate care that is being paid for, would be the argument. It seems a little frightening too. We need to know,
Yeah.
and you know this because you're the expert in this field, that the federal government goes after and recoups money at a huge amount every year, and we get the number usually sometime around February or March about the prior year of what they've done. But just for healthcare, it is always over $2 billion.
Yeah.
And so if
Yeah.
you're thinking about that, a couple $100 million a month just out of healthcare that the federal government is going after and recouping from people. And is all of that inappropriately been paid out to begin with? Maybe, but my guess is a lot of times people just make honest mistakes. The
Yeah.
penalties are so high that if you get caught up in this, a lot of times people just pay to end the problem because the process is so expensive and long and horrific that they just make a business decision to pay something and move on, which is sad. But and it speaks for the whole reason why people should hire you to help them make sure that they don't have issues with their billing. Because once you get caught up in these cogs, it is painful and expensive.
Yeah, can get messy real quick. You and I have both worked on things together where that's, and they just try to, it's like they wear you down. So,
They do.
yeah, it's sad. But yeah, you'll have to, I want some more information on that new, excuse me, the new false claims thing,
Sure.
because I think that would be an interesting thing to like do an article on,
Absolutely.
because I try, as you do, there's so many things out
Uh,
there, you can't keep abreast of everything. But that one kind of, I mean, I was surprised by that. I hadn't, I
I,
did
I
not
was I
know
was
about that
surprised
one.
too, and like you, I probably start my day off with an hour and a half to 2 hours of just reading new things that are coming out and trying to pick up on trends. But it's just so voluminous. You're right; it's easy for things to
Yeah.
slip through the cracks. So happy to try to share information with people anytime I can.
Yes, great. Well, okay. Well, thanks for all of the background and the good conversation. But I did
Sure,
promise people that we would take some questions if anybody had any. With the, I know Mike's got a hard stop here, so we got about 5 minutes. If anybody has some questions for Mike, and please remember that if you're going to ask a question, that you kind of redact some information out of the question so that it's not so specific that it can be identifiable. These broadcasts that I do get recorded, so just keep that in mind if you have a question for him.
yep.
So
Every
just
question should start off with "I have a friend," comma, and then you can go right ahead and ask whatever you want.
or hypothetically is what I
Yeah,
used to do in my classes. I'd always say somebody'd ask a question. I said, "You mean hypothetically?" And they'd look at me. And they were like, "No, no, I mean, I think, no, no, you mean
that's
hypothetically."
right.
There's like 200 people in the room. Then it's kind of like, "Oh yes, hypothetically."
I recently read on a messenger board, comma. Yeah, that's how we do our questions. That's right. We don't want anybody coming back and having trouble.
All right, let me see. I don't see anything coming across, but again, that could be from the issue we were having before. So, to all of those of y'all that may be watching the recording of this that gets posted, I will have Mike. Mike is nicely said that he would come back again, so we'll have him come back on again, where there will be hopefully the full round of attendees that wanted to get in today that
Sure.
can ask him some questions. Um, because I am
Excellent.
not having anything. Is there anything, words of wisdom kind of thing you would like to, impart upon anybody before we let you go?
I think that we're entering a good time of the year because we're about to start 2022. And I try to encourage people to map out over the year what they're going to do as far as getting up to speed on coding and billing. Have someone like yourself where it could be scheduled, because so many times you just get in the midst of the day and it's a firefight, and this long range planning is difficult to do once you're in it. I know we've got a lot of patients trying to get in before they have a whole new deductible, or come January 1. So it may be wildly busy, but come the first week or two of January, that's, I think, the time to regroup for 2022 and plan out. Look, compliance is never any fun, right? And I try to make it happy and exciting, but it's an uphill battle. What we need to do is just break it down into little parts. I can, Betty, I'll be glad to share. We do a compliance calendar of just kind of spacing out
Oh,
activities
great.
for folks, if that helps at all, because it seems like an overwhelming task, and a lot of these things are not that difficult. You can do them yourself. It's just a matter of reminding yourself and spreading them out over time. And so that's, I think, the time to focus in on it is coming up here in early January. And I sure hope that everybody has, and let's all hope that we have a happier, safer 2022. And
Yes.
I think
Not
working with you,
non-pandemic.
Betty, helps out. So thank you.
Oh, thanks, Mike. We did get a question, and it says, "How often do you see providers penalized for anti-kickback lawsuits?"
Um, with some regularity, there's been a good bit of activity in Stark laws, which are when they say Stark, it was named after the person that came up with the idea. I think it was Pete Stark from Arizona. But anyway, who's no longer in Congress. But in answer to that question, yes, it does come up oftentimes with referrals to different kinds of organizations. Just yesterday, I was reading about kickback schemes for using certain types of medical devices, where if you were to use this type of a device, you would be paid additional money on the side. These kind of
Mm,
schemes are inappropriate and can lead to real problems. Or for the general practitioner, that the surgeon says, for everybody you send to me, I'll, to do a case, I'll pay you $250. These are the kind of things that not only are a bad idea, but violate the law and can cause a lot of trouble. And so, yes, we do see this. It's not something esoteric that's just kind of theoretical that could happen every once in a while. I read about it weekly.
Yeah, I always tell for when I talk to coders who kind of put questions like that out, like, well, how about, or is this? I tell them, you're using your common sense. If your spidey senses start to tingle, yeah, it's probably not something that you should be involved in. So, a lot of the stuff with it that I've seen, it is pretty, like it is not really shaded, or it's pretty upfront that that's what's going on. You give us this, we'll give you that kind of thing. And so I think that's something that is usually pretty straightforward to kind of figure out. Do you agree with that?
I think so. Sometimes it's a little bit more subtle than you give me a patient, I give you a check. That's pretty clear. And look, if we were in the business world, a lot of these things go by daily and are fine, right? If we were in real estate, everyone would think we were silly if we talked about working without a commission. But when it comes to healthcare, we can't do that. Where I see people having problems is, let's say you're a surgical practice and you have extra office space and you run out to some general practitioners, primary care folks, and you think that it would be helpful to have them nearby. You're going to charge them rent, but you give them a great deal. Even that can violate the law, right? It doesn't have to be so obvious as, if you send me a patient, I send you a check. It's we've given you a good deal, or you can use, we've got an EMR system. We'll be glad to let you use it at no cost to try to help you with overhead. It'd be better for everyone, kind of blah, blah. Look, if you're paying, if someone is paying below market rate for something, you have the fear of a kickback being involved because of expectations of referrals. So, got to be careful.
Yeah, that below market rate thing, I think, is a nice, kind of even line to be able to point to. Like if the going rate is $40 a square foot, and you're being charged 10. Well, okay, what else is going on in there? You
Probably
know,
not your winning personality that's gotten you the
as
decrease,
much
right?
as you like to think so, right?
Exactly.
All right. Well, it's time for us. I know you have to go, Mike. So I appreciate you joining me.
Thank you
And
so much
once
for having
again,
me. Oh, this has been
yes, this has been
fabulous. I
very
look forward
nice.
to getting together again and answering questions.
Thank you. So Mike will be back again. Watch for the notices on healthcare happenings to come up. But again, thank you. And if I don't see you again, or y'all listening, I might do one right before Christmas, but I'm not sure. But if I don't, Merry Christmas, everybody, and Happy Holidays. So thanks,
Ha-
Mike.
Happy holidays. Merry ho ho. Thank you.
Thanks. Bye bye.
Bye bye.